And now we would like to invite our panel. Bas Hoefman, who is co-founder and director at Text to Change. We would also like to invite Gunther Faber, chairman and CEO of OneFamilyHealth, and Angus Rowe, chairman of LifeSense Group. A warm welcome.
Good morning. Good morning, gentlemen.
Morning.
Just one question. We've seen two in the keynote and the plenary now, and I mean, we saw some incredible facts and figures. 71% of Bangladesh being connected with mobile phones, of only which 23% had electricity, and you know, it's a mind-boggling kind of figures. And in Sweden, we have Professor Hans Rosling, who shows us. He tells us about how our world view is incorrect. That we think that the world is a lot more sort of underdeveloped than it actually is. Is it? I mean, is our view as outdated as Hans Rosling and also Alan spoke about?
Yeah, I believe so. I started working in Africa back in 2006, 2007, and you really see that, of course, there is poverty, but you can really see that the middle class is growing. People have access to mobile phones, even access to smartphones. So they're willing to educate themselves, so they have access to good quality data. So of course there is still poverty, but they are changing, and you can really see that. That's very apparent.
Can you tell us, what did you do in Africa, and where were you?
I lived in Uganda for 5 years, and we executed one of the first large-scale mHealth campaigns, an HIV/AIDS quiz targeting people with the multiple choice questions on HIV/AIDS in order to educate them and also to encourage them to go for testing.
And especially in Uganda, when you talk about AIDS, there are a lot of cultural problems that there's a lot of taboo around the subject of sexuality, AIDS, and sexual disease. Do you think that using mHealth tools can actually help you overcome that bump?
Yeah, and definitely it's a good addition to what's already happening there. It has a long history of HIV/AIDS education. It's quite a successful country, Uganda, as such. But it was about time to repackage the old messages, and mobile technology is just another channel of communication. It's true what you say in terms of cultural differences, taboos, and for example, a woman that receives a message on her phone is more anonymous, and it's good to a good mode of communication to communicate the more sensitive subjects.
What are the challenges in regards to giving health to everyone?
Well, Africa is not a continent that's just Africa. It's like Europe. It's got lots of little countries in it. Each one of them are run differently. You've got different political structures. You've got different religious beliefs. And all this has an influence. But the biggest problem, if you look at Africa, is the economic development. It's still way behind. And if you just take a snapshot and you say, Africa, in many parts of Africa, their healthcare cycle is where Europe was in the beginning of the 19th century. Sanitation, clean water, all these issues around. But where does government get money from? It doesn't grow. They either get it from taxing companies or they tax individuals. So if you haven't got big companies in your country, you're not going to have tax from that. If you haven't got economic growth, you can't tax the people. And it's estimated that at least 55% of the African economy is the grey economy. It is traders at work. There's no tax collection and nothing. So there are issues. I mean, you've got the technology. It's lovely. You've got a mobile phone. You've got this app. You've got that app. It's a trial. But as the previous speaker says, the implementation of that is the issue to get on that last mile. So I think it's fantastic. Africa has leapfrogged technology. They've never had any copper wires. I got a tear in my eye when I saw the pigeon, because, you know, that took me back to the First World War. You guys, I was there. So, but there's no doubt that it's a huge opportunity, and I believe that the developing world is, because of the lack of resource, will beat the developed world, and the developed world can learn a lot from the developing world in terms of cost containment and delivery healthcare.
Yeah, I think I'm Angus. I live in South Africa, so I've grown up in Africa and worked across most of the countries in sub-Saharan Africa and some on the west coast. And I think you asked the question, what's the biggest problem? It's access to health.
Sorry, it is?
Access to healthcare. So you can have all the mobile technology available, but if there isn't the service provision in geographical areas, it doesn't help. So one needs to understand the cultural beliefs to healthcare and the need for primary healthcare. It's very important, and people travel vast distances just to urban areas to get access to primary healthcare. So mobile technology helps in educating the patient, but they still need to access the actual healthcare service, and that's the biggest challenge that Africa faces, and it does differ from country to country depending on political structures. So I think access is definitely where you've got to start.
Can you tell us what it is that you do in your company?
Okay, well, we work across diseases, so we manage HIV/AIDS and diabetes as a chronic disease management company, and have done for over 14 years in South Africa, and attempted to do it in a few African countries. And the other side is we developed a clinic management system on a mobile phone, so for entry-level primary healthcare clinics. So it's not a pilot, and I was very pleased to hear the gentleman say that, you know, there are more pilots in Africa or in the developing world than there are in the US Air Force. And it's absolutely true, and that's the sad side of mHealth, is that seems to be a lot of pilots, but nothing's getting implemented. So there's a lot of innovation, but no implementation on a grander scale other than a pilot. In Rwanda, we've implemented our system. It's currently running on 90 primary healthcare clinics across Rwanda. It's linked in a public-private partnership with the Rwandan government, so it is part of the total national health system, and it focuses our client, who's OneFamilyHealth, Dr. Faber, who's sitting next to me, which focuses on 70% of the diseases that account for 40% of the deaths in that particular region. So that was the start. We can't do everything, but it is an agnostic program, so it's not disease-specific as such, but it is a platform that you can build specific applications on top of, and that's what we do. We've done over 300,000 patients on that now. So.
I've been, in fact, there's not an African country that I haven't put my foot in. I worked for a large pharmaceutical company and was in the international division, so I've got about 30-odd years in the developing world. And the model, and what I was looking at, is how could you prove access to healthcare, and I ran the company's access to health portfolio for 10 years, so interacting with WHO, all these multilateral organizations. And the big issue, people say patents kill patients in the developing world, pointing the fingers at the pharmaceutical companies, not that. It is access. It's that last kilometer or mile to getting the product to where it's needed, which is at the patient level. So that's when I set up this, aiming at entry-level primary health care, as I say, causing 70% of the conditions can be seen to, and 40% of the deaths result from that. And that's when I've known Angus for years, and I said to him, we need something here. And we developed with Angus. He brought the technology, and we had the people online in doing that.
Just one short, if you have any questions, please send them in via Twitter, and we'll get them up on our screens here, and we can ask the panel. If there's anybody else that wants to ask the panel any questions during the session here. I had a question that is both a question and a comment. I mean, I work at the KTH, at the Tech Institute, and we do student competitions, and one we did a couple of years back, and we've been doing annually now, is a competition where we gather students from the 4 or 5 of the big schools in Stockholm, and we do a 48-hour, like an innovation competition on solving challenges, you know. And one interesting aspect of that, when we had people from Africa come up and talk to us, was that they said, you know, well, first of all, you need to start innovating on the right level. You can't innovate in the classroom where you have like electricity in the walls and running water over by the toilets. That's one thing. And second of all, remember, don't think up new gadgets or services. There are enough gadgets or services. You need to think up business models and actual systems to get things working. Yeah. You mentioned the pilot problem. And how do you feel? And I see, the whole development of M-Health, M-Finance, and M-Education. It all comes together here because, Hans Rosling again, he says that the best thing we can do for a country is educate the women and the young girls. Yes. We do that, we're cool. And it all comes together, this whole thing. And you mentioned the education aspect as well. And it's comments on this? It's such an interesting.
No, I think it's absolutely vital, and that's why we've got a definitive model on the ground using nurses developing business format franchise nurse-owned clinics. We give them a loan, startup loan. They start their little business. And they run it like a business. It's a private for-profit business. So those nurses work 6 days a week from 8 in the morning till 8 at night. And if the community says we want the clinic open on a Sunday, they will hire another nurse to come in there. So, and suddenly, because we work to set principles, our clinic's got to be kept clean. So she can't do it, so she hires a little lady from the village. And suddenly you find an old woman in a village that's never had a job before, that had to beg her husband to give her money that he most likely earned from selling a goat. I'm talking now base stuff. And this woman is empowered. She can go to the local market and go and buy a little second-hand dress. She feels good. With our 85 clinics that we've got open now, we have created roughly 355 new jobs in the private sector in Rwanda. And you're looking at the gender too. There are more nurses are women. And there is no doubt they become very, very important within the communities where they live.
Bas, you're nodding your head.
Yeah. So in terms of what you said about innovations, that you don't need new stuff, or you don't need to have tested things from the West in Africa. I think it's very important to use technologies that are already proven to be successful, such as a common example, always M-Pesa. So if it comes to M-Health, it will probably, the successful things will probably spin off of already successful technologies that already work in Africa.
I think that the advantage the developing world has, it's an empty room as such, is that there is no real legacy of the past. So we can look at the lessons from the developed world. We know the developed world is now, there's a shift in the way healthcare is going to be provided, and we can head in that direction. But I think the main thing in the whole of M-Health innovation is you must look at the other socio-economic implications it has. So there's huge urbanization of skill and hence the lack of access in rural areas. So by using the OneFamilyHealth model where the nurse owns their own clinic, you're encouraging entrepreneurship back in the rural area, which then has a spin-off of other innovation outside of M-Health around that clinic. So it's important to look at that because that's where you'll get the geographic footprint that starts to set up, that makes M-Health absolutely possible in the developing world.
We touched on that subject slightly yesterday, that we have in the developed countries, we have a legacy that sometimes maybe slows us down a little bit. Do you think that maybe in the future we will look in the developing countries to find new solutions for our healthcare systems?
Well, I think in Europe you've got an aging population. In Africa we've got a youth population. Yeah. So our requirements are very different to what perhaps your innovation is in Europe. But yes, definitely. I mean, I think the advantage of that, and I think one of the other gentlemen said they were surprised to see that, their connectivity in Bangladesh was greater than that of Baltimore. Well, it was an empty room, so they leapfrogged rather than evolved the technology and got the latest that was available. And I think the same thing will happen in healthcare as well.
I think there's definitely the developed world can learn, and some of you might have heard of a WISH. It's in actual fact the Qatar Foundation with Imperial College. They're running, they meet on an annual basis. So they had 2 meetings, one in London, one in Doha. They're having another one early next year, where they are saying this is the developed world. We've got these systems that have been there for a long time. How can we make them more affordable? And an issue like task shifting is going to affect the developed world as much as it's going to affect the developing world, because the more high educated a professional person is, the more expensive they become. And especially in Europe, where you've got social health care, with an aging population, young people are not going to be happy to pay more on taxes. So you've got to look, and this is where I think the benefit of mHealth is going to come in, and multiplying a professional, say a top cardiac surgeon in Sweden, where he can do 100 times, see 100 more patients, or indirectly handle 100 more patients than he currently does. So I can definitely see that technology will have a major, major influence.
Yeah, I'm just looking at the Twitter feed as well. One question that came in that passed very quickly here was that, okay, fine, so you're saying educate the women and everything will okay, but does that mean that the men are incompetent, or what are we saying here?
Sorry, does that mean?
The quote about, you know, educate the women, and that is the best way to drive economic growth in a country. So, but what about the males?
We've had it as a gender.
Sorry?
Males, we've had it. No. I think it cuts both ways. It's education of women is extremely important, but as is the male. You know, it's not only females that come to the clinics. I've often seen fathers coming with a little kid. So the males are as much part of the deal as the females are, and depending on whether it's a chronic disease, but it's the males are there too. But let's face it, the nurturing and bringing up of children anywhere in the world, it's the mother and it's a woman that has got that biggest burden on bringing that little kid up. So naturally, the focus has to be in that area, but it doesn't say that the focus shouldn't be on the male too, because there's a support service and function that the male can give the female to encourage her.
I think you've got to remember too that in certain parts of the developing world there's migrant labour, so very often a mother is left at home with her children and there isn't a male there. So it is a good point to start with a family unit.
So, I mean, as an entrepreneur and as a tech transfer manager and a business coach, you know, it's you get all these ideas of, we could do this and must be able to do this. I mean, is there an actual business opportunity? I mean, now we've come past the technology possibilities. We talked about the impossibles, and we're talking also about the whole empowerment of the whole developing world. But as it comes into actual user need in focus, and there is a business perspective. But is there actually business to be done as an entrepreneur? Is it involving
in terms of mHealth? You mean? So in the line of work we are doing, sending messages and to the feature phones, basic phones, so disseminating health information. It's extremely challenging to charge people, the end users, for health information. You need extremely good content, which is a very big challenge as well, to create good, valuable content and translate it into mobile. But having a business model out of health is very challenging. So I believe in packaging it with other information, like agriculture information, educational information, or just entertainment. So you have a package deal in terms of information. But if you read Scale, what we do in Tanzania, we work with all operators, all mobile operators, and they offer their services for free, or the traffic we have on our system, SMS traffic, they offer it for free. But in exchange, they want to push their own paid health services to the same audience. So we see a lot of these cross-selling methods or business agreements coming up. But it needs to be said that the content they disseminate needs to be in line with your program, so that you're not going to sell alcohol or something, or push promotional messages with regards to products that are not in line with the content of the program.
We were thinking if you transfer that challenge to the Western world, who is the customer? Is it the patient getting help that should pay for it? Like you mentioned, that's somewhat difficult. Or is it the taxpayers, that they are relieved from yet another patient that will probably cost a lot more in healthcare? Who is the final? Who's going to pay for it?
Yeah, I'll take that.
Yeah.
I think to answer your question first, but it'll cover yours as well, is there a business? Yes, there is, but it depends on your territory. So if you're looking in the developing world, where's only where I can really speak, and specifically Africa, so I don't have any experience in India or any of the other parts of the developing world, is that you need to understand the territory you're going to. That's why there's so many pilots, and after the pilot, it's gone. Because they all have a need, these wonderful innovations, there's no doubt about it. But I think people are more sold on the actual innovation that they've done rather than how they're going to implement it, and that's the challenge. So the first thing is understand where you're going to be doing it, and because it's healthcare, it involves everyone in the country. There doesn't necessarily have that you don't necessarily have the access to who the customer is. It might be the government, it might be donor funding to start before you're able to prove that it works, and then the government would come in. So you need to understand your whole cycle of that business in that particular country before you go there. Otherwise, it will be a pilot and it will die. And one of the things that I was thinking is, you know, having worked in this for a long time, there have been a lot of pilots, and you see a lot of innovation, and every time you go to a conference, you see the latest stuff. But no one shows the stuff from 5 years before, and where is it now? And a lot of it's gone. Because there was not proper implementation plans put in place, or how they were going to keep it sustainable.
If you don't have the business model, it will never survive.
It has to be business sustainable, whether you're in the developed world or the developing world. And I think the big issue is, and over 30 years in the developing world in business, where we ran a lot of social programs. I mean, in the end, shortly before I left as a company, we spent over £300 million a year on social programs around the globe. And the saddest thing is to see when you fund something that has got possibilities, and if you withdraw your funding, that it inevitably dies. And that is the worst. And if you look at how many billions of dollars of aid goes into the developing world, and especially Africa, it also makes you think what happens. Because for every dollar that is put into Africa, the given country government will take $1, if it's healthcare, will take $1 out of their healthcare because they haven't got the money, they could spend it somewhere else in education. But even so, it's a huge amount of money. And then the donor funding that comes into, it's managed via auditors and all the way down. And I might be sticking my neck out because I'm now on the other side of the fence. But I'd be surprised if more than 15 to a maximum of 20% of the funds that goes into donor funding or enriches the patient. I think a lot of it is wasted in administration and control systems to make sure that the money gets there. So it's a very frustrating business. But I think the important thing, it's got to be business sustainable. And in Europe, if M-Health will deliver better health at a lower cost, and it'll help the socialist system and the infrastructure last longer because they will be able to afford it. Because otherwise, you don't want to get to a point where you can't afford healthcare anymore.
So in order to create a sustainable business model, you need to define who is the customer. So what do you say? Who is the customer then? Is it society or is it the patient? Who's going to pay for it?
Well, I think the best way to do it is look at it as an example and some proper case studies. That if you look in Rwanda, the customer is obviously ultimately the patient, but in order to be effective and to make it sustainable for those clinics and those nurses to have those primary healthcare clinics, the government had to be part of it. It had to be all-inclusive as part of the national health system. Otherwise, you stand outside of that, and your chances of failure are much greater. So it has to be inclusive of a bigger pie. You might only be doing one piece of it, but you need to fit into the whole pie. You cannot stand alone in these things.
Okay.
Yeah, you had a comment on that? Or
No, I fully agree that you need government involvement from the start in order to succeed. Yeah.
So all of these people who are here today, I mean, and yesterday as well, I mean, we're here because we want to co-create a future somehow. If we want to address these questions, I mean, I see possibilities here in everything from reorganizing the charities as well and getting the money to go to the right place. But that's a separate conference. But where would they start? Where would one start if one has an idea? I mean, where do I start? Who do I phone? And where do I go? And what's?
Well, I think first of all, you've got to have a passion. I'm a zealot for this model because I've seen over 30 years of what the needs are. So I look at it from my perspective and I say that is the space I'm going to go for, entry-level healthcare. And then if you say, okay, you need money, so you obviously have to get seed money, and you've got to build it up. I will not prove my model as being business sustainable until I've reached 250, maybe 300 clinics in Rwanda, at which stage, me, the franchisor, I will become profitable. And I'll start making money, not big money, but I'll start making money. Then it's business sustainable. So it is still an experiment, but it's an experiment that is on the ground. And it's not easy. You get more rejections and you get acceptances. Funding is a big issue. I took out a personal loan of $12.7 million that I've got to pay back. And if that's not a leap in faith, but then again, when I look at those charts, I think I'll most likely be at the 80 stage and I'll fall off the cliff. But so you've got to have the passion to do that and pick something. And the most important thing, which Angus mentioned, you go into a market, do a proper assessment of that market. I mean, we did country assessment studies in a number of countries, and you put professionals in there to do an assessment of everything, and it takes at least 3 months to do a proper country assessment study. Then you start taking the data and you use unit economic modeling to see if your model is going to work. But it's persistence and knocking on doors.
Thank you so much for sharing your passion with us. Thanks for our beautiful panel.
Thank you.